Hi, I'm Beth Peterman. I'm the Nursing Center Director for the UWM House of Peace Community Nursing Center. We're a nurse-managed clinic, and we are part of the Free Clinic Collaborative. And we are also, our major function is to be here as an academic learning center for our nursing students at the University of Wisconsin, Milwaukee. I do the work that I do because I have a passion about community. I started out as a public health nurse with the city of Milwaukee in 1974 and loved every minute of my work. Became a little frustrated with the bureaucracy because I was very young at that point, and left for a while, but knew that I always would come back to it. And I've been back now for 9.5 years, and I love it. And continue to do it because I believe that people deserve health care services whether they have insurance or they don't have it. As an academic learning center, we certainly share our community expertise and try to ingrain in students what the importance of community health is. And the work that needs to be done in community is huge, especially in certain areas of the city of Milwaukee, but as a whole across the nation because of economic downturns. In between semesters is when we could really use volunteer help. And the types of volunteers that I would like to see in the clinic are a variety. We have people who struggle with literacy-related problems, some basic reading and writing issues, and some are health literacy related issues. So having volunteers who are teachers from other walks of life and not just teaching nursing school would also be beneficial for us here. People who are interested in helping us with cleaning and sorting things like materials, some of the materials we have for patients that we have to go through periodically and filter out what's good and what's bad, or some of the things that we'd like to be able to do or offer to clients when they're in our waiting room. We have a hard time setting up some of those program pieces as well for individuals who are not teachers, nurses, student nurses, but who would still like to be involved in helping us. What do I think is important for volunteers to know about our clinic? I think it's important for them to know that we are co-located in a community center called the House of Peace. And because we are co-located and we live in this space free of charge, we have to honor the House of Peace and their requests and their hours of operation as we set about trying to do our work here. Our services for people who are uninsured or underinsured are paid for in 3 different ways. We either use a sliding fee scale basis for fees that we charge clients for services here, or depending on the client's circumstances, their fees can be waived, and we can get some reimbursement through the House of Peace funds that they acquire to support our activity in the nursing center, or programming or project funds can be obtained for certain services such as women's health through the Wisconsin Well Woman program. I love what I do. I love being at the House of Peace. We've been here for 20 years as a nursing center. The House of Peace has been in the community for 42 years now, come February of 2012. And the partnership here has been good, and we believe that we do good work with the people that we see and serve.